Since 1999, the number of drug overdose deaths in the U.S. has more than quadrupled, according to the National Institute on Drug Abuse. Spurred by the explosion of opioid prescriptions, more Americans die by OD every year than died in the whole Vietnam War. While the nation struggles to get a handle on the opioid crisis, the RXSafe Del Norte Coalition is working locally to engage the community in the prevention of opioid use disorders, the reduction of stigma, and the promotion of treatment, recovery, and wellness, as their mission statement reads. We sat down with Jermaine Brubaker of RXSafe Del Norte recently to talk about the opioid crisis in Del Norte and just how the coalition is combating it. Here's Jermaine.
So RXSafe Del Norte is a community coalition in response to opioid use and opioid use disorder in our community. It's a group of agencies, community members, local organizations that have come together and really wanted to make sure that we are not having any opioid deaths in our community and that we're really increasing access, decreasing stigma, and really trying to address the opioid issue. It's a national epidemic. It's not something that is in our face here in the community yet.
Do you have any sort of understanding as far as the extent of opioid abuse or just the whole situation in Del Norte County?
Oh, I have some data.
Do you? That's what I was hoping. I was hoping we had some data.
Yeah. So, what some of the surprising things is there's these, and all this is 2017 data because it takes a little while for, the number crunchers to catch up to us.
For it all to trickle up.
Yes. So this is really interesting. We have a population of about 27,000 here in Del Norte County. Mm-hmm. We have almost 34,000 opioid prescriptions in our community.
7,000 more prescriptions than people?
Yes.
So what is this then? Are these people with multiple prescriptions? Are these people doing...
Yeah, that's some of the data that we're trying to really figure out. But we're really trying... One of the aspects of this is often opioid abuse starts with an opioid prescription. And so these could be people with multiple prescriptions. This could be just over-prescribing. So we're not only working on the end user of opioid users and substance abuse, but also looking at prevention up the road, like what other alternative treatments are there out there? What other pain management treatments? How do we reduce even opioid prescriptions? We have opioid prescriptions to even 0 to 5-year-olds in this community.
Oh my gosh.
Yeah. and so we're really trying to dig into this data and figure out like, what does this mean? And I mean, it says less than 6 actual count, but if you're looking at rates, to help us compare to like other communities, you look at a rate.
You look at the percentage as opposed to that.
So it's a per 100,000 population rate, right? Mm-hmm. So it gets really confusing when you're looking at numbers sometimes. But for example, the state of California, when it comes to opioid deaths, the rate is 5.23. Here in Del Norte County.
Per what?
Per 100,000.
Per 100,000. Okay. Okay.
So that helps us compare to other communities and really
that's
because we're such a
statewide.
So statewide is 5.23. Del Norte County is 12.56.
Oh my God.
Yeah. So that's 4 actual deaths, but when you look at the size of our population, that's where you're like, oh, this is a big impact in our community.
Wow. Yeah. Who's running the RX-Safe program? Under what auspices?
So it's a grant through Aegis Treatment Centers that is administered by Open Door.
Okay.
And then the coalition is a coalition of the willing.
Of the willing, exactly.
And those who are interested. And anybody is welcome to attend our meetings as well.
When are those?
So I would contact me directly. They move around a little bit. We're trying to get a set date that works best for people. We'll have our next one in April. We just had our March one yesterday. So that one. So you can contact us directly. Either at rxsafedelnorte@gmail.com, and I'll put you on the email list.
Okay.
Or you can give us a call at 957-0561.
957-0561. Are you on Facebook?
Yes, we're on Facebook as well.
Okay. One of the things RXSafe Del Norte is doing locally is to offer training for any concerned person on the proper administration of Naloxone. They've recently scheduled several training sessions around the county, with the next happening Monday, March 25th, at the Community Health Center in Crescent City. What is naloxone, and how can it help in an incident involving opioids? Here's Jermaine again.
One of the things that can save somebody from an overdose is naloxone. So naloxone, also known as Narcan, is a drug that will reduce an overdose or a poisoning. We are trying to change the nomenclature a little bit too.
Okay. What was it? Because everybody just thinks, it reverses opioids, right?
Right. So
is that not true? Is that not accurate?
Well, what it does is, so when somebody is in a poisoning or an overdose, the receptors for opioids are overloaded.
Mm-hmm.
So what this does is it knocks those opioids off the receptors. So it brings somebody out of an overdose or a poisoning.
Wow.
So what happens during that event is the respiration gets so low that people can actually stop breathing. The heart rate can slow down to the point where the heart can stop. So this can help bring somebody out of that. Mm-hmm. It won't, if somebody uses right again, they'll probably go back into an overdose. This isn't something that's long lasting. You still need to call 911. We still need to address the issue, but it breaks that enough to save their life.
Okay.
Because if somebody's not breathing and their heart's not working, we want to make sure we can get medical treatment.
Okay, so you're offering this workshop seminar? What would you call it?
Yeah, so I'm calling it a training.
A training.
Yeah.
So a training on the administration of and I know it is Narcan. What was it you were calling?
Naloxone.
Naloxone. That's it. I couldn't remember.
Yeah, it's all about which drug are you using?
Is it a brand name thing?
Yeah, it is a brand name thing. And this is the nasal spray. There's also the intramuscular injection that's available, but this is a nasal spray that we have.
Okay,
yeah.
Okay.
And we were able to get this. This is actually through a public health grant. So public health was able to get almost 300 doses. Mm-hmm. And so, but in each kit, we make sure that there's 2 doses, because sometimes just through the act of like trying to administer something, you
whoops.
You
squeeze it and it's off. And
or the first one isn't quite working and you just want to double up. So we want to make sure that there's 2 doses per kit for everybody.
What is it with the kits? Where are these kits?
So right now they're at public health, but
sure, but where will they be?
Oh, where do we want to get them? I want to get them in the hands of as many people as possible.
So in public places, in private individuals, just handing out everywhere.
Yes.
So wow, okay.
This is think of it as part of your first aid kit. Mm-hmm. Think of it as having the ability to have like a defibrillator on you, and you're trained. You're providing a life-saving measure to somebody who can then get treatment. And we're finding that people who are having overdoses and poisonings on opioids, it's an older population and it's prescription drugs.
KFUG DJ and local assistant librarian Lisa Costin took part this week in a Train the Trainer session offered in Klamath by RXSafe Del Norte. Afterwards, we asked her to share some of her newfound wisdom.
Naloxone can reverse the effects of an opioid overdose. It can bring somebody back from death, basically. So it's a life-saving thing to be able to have. And I was training so I can train everyone else in the library, because libraries have become a place in which people seem to often overdose.
Oh, wow.
Humboldt County's had a few people overdose in their library.
Oh, my gosh.
Yeah, so it's really important. The training is really important.
So if you find somebody mm-hmm. and they're out, I mean, you learn the whole. So let's just say you're going through the library and you find somebody and they're there on the ground and you don't know what's going on. What do you do? What did you learn today?
Well, the first thing you have to do is try to wake them up. Mm-hmm. And what they suggest is first to say, "Hey, are you okay?" Kind of, shake them a little bit. And if that doesn't wake them up, you're supposed to rub their sternum with your knuckles really hard, because that's really painful. And if somebody's even in a deep sleep, it should wake them up. Mm-hmm. And, just try to get out of the way in case they come up swinging or something. But the first step is to make sure they're actually unconscious and unresponsive. Mm-hmm. And the next step would be to check whether they're breathing. And this says that the next thing that you do is call 911, and then you try to do breathing for them. If they're not breathing at least one breath every 5 seconds, then you pinch their nose and tilt their head back and give them one breath every 5 seconds. But if they don't start breathing, that's when you inject the Narcan, or not inject, sorry, we've got the nasal spray. That's when you spray the Narcan into their nose. And that should bring them back within a matter of seconds or a minute.
Wow. Wow. Now, is there any concern if you find somebody and you don't know for sure that they are suffering from some sort of overdose? Is there any concern with administering the Narcan?
We found out that if someone doesn't have opioids on board, it doesn't do any harm.
Wow,
The
okay.
Narcan really just won't do anything because it's got nothing to attach to. Before I forget to mention this, I take Suboxone as part of the medication treatment assisted program. And they told us that if you don't have Narcan, but you do have Suboxone, and it's got to be Suboxone, it can't be Subutex because Suboxone has Naloxone in it. You can put a strip of Suboxone under their tongue and it can work like, like Narcan.
Oh, that's fabulous.
So
Wow.
as a last resort, and if you're lucky enough to have Suboxone on you, that can also work to reverse an overdose.
Wow, and so you've got one of the kits. Let's see that. What's in the kit? It's a little, it looks like a fanny pack, but it's a, oh, that's great. What does it say on the side? Opioid reversal kit.
Opioid
Perfect.
reversal kit, and it's got Narcan. This is 2 doses of Narcan nasal spray, 4 milligrams. It's got a thing you use to put between you and the other person's mouth for both their sake and your own, and gloves because you've got to clear the airway in case there's anything in the like vomit or anything.
And let's be graphic. Clearing the airway means sticking your fingers in their mouth.
Yes.
Yeah. Okay.
Yes, because you don't want anything that they can aspirate
Yeah.
if they start breathing.
Oh wow! So this is a good tool. You're looking forward to having this. Where are you going to put that pack? Where are you going to keep the kit?
Well, I'll have to talk to the staff and make sure. We may put it above the sink in the break room because that's an easy place to access it. Everyone knows where it is. That's where we keep the first aid kit. And this is really important. And actually, I spoke to the woman in charge about perhaps getting a community meeting together, maybe in the library, where everyone can learn to use this.
Okay, so moving forward, you are a trained trainer now.
I am.
So getting some folks together at the library, maybe some sort of a meeting, and sort of spread this knowledge around.
Yes, we have a staff meeting, I believe the 27th, and so I will be teaching everybody. I was really happy to have I had the Narcan before from the Walmart pharmacy, but I wasn't confident that I knew how to use it. So now we have 2 kits. And for anyone that doesn't really feel that we should be spending the money on something like this, please remember that addicts can get well, they can get better, they can change their lives, and it takes an average of 12 times of trying before someone gets clean. So please, we want to give everyone every opportunity to get their life back.
The last Naloxone training session in this initial round is happening Monday, March 25th at 11 a.m. at the Del Norte Community Health Center at 550 East Washington Boulevard in Crescent City. To find out more about RXSafe Del Norte, call 707-957-0561 or email rxsafedelnorte@gmail.com. Their website is rxsafedelnorte.org. They're on Facebook as well. Thanks to Jermaine Brubaker of RXSafe Del Norte and Lisa the librarian for talking with us. For KFUG Community Radio, I'm Paul Kritz.